Hi friends, today we are going to discuss about Cushing syndrome and we will move from the base. So you can see the picture here. This is Harvey Cushing. Cushing syndrome named after the famous neurosurgeon having Cushing, who described it is an endocrine disorder with elevated cortisol level in the body. So in our body, the cortisol level is elevated, then it leads to a syndrome called Cushing syndrome. So some cases, an increased cortisol via result from pituitary adenoma, then it excesses the ACTH, leads to Cushing disease. Normally, our hypothalamus is located at the base of the brain, and normally this hypothalamus is secreting. So this is secreting one hormone, corticotrophin releasing hormone. Also we can call CRH. So normally the hypothalamus is secreting this corticotrophin releasing hormone CRH. Then this hormone will stimulate, this CRH will stimulate our pituitary gland to produce one hormone. So CRH will stimulate pituitary gland and the pituitary gland will produce adrenocorticotrophin hormone. Also we can call as ACTH. Then this ACTH will travel to the adrenal gland, which is present in the top of each kidney. So this adrenal gland is present in the top of the kidney, and this hormone ACTH will act specifically a target cell in the cortex. Cortex is present in the adrenal gland. So I think this much you understand. So here it acts on the specific target cell in the cortex. So adrenal cortex is the outer part of the adrenal gland, subdivided into three layers: zona glomerulosa, fasciculata, reticularis. This everything we discussed in our last video. If you are not remembering these things like basic information, just go to our last video and just watch it out one more time. So zona glomerulosa, fasciculata and reticularis is the three layer of adrenal cortex, and fasciculata is the middle and widest one, and from fasciculata, ZF means zona fasciculata. From here, the cortisol is producing. Cortisol is a steroid or lipid soluble hormone, also you can call glucocorticoids. Okay. So this cortisol or this glucocorticoids, these are not soluble in water. The main point is these are not soluble in water. This is lipid soluble hormones. That means it's not soluble in water. So where it is going and where it is acting. So most cortisol in the blood is bound to a specific carrier protein. What is the name of this specific carrier protein? Yes, I'm telling that water soluble, not a water soluble, and this cortisol is in blood. It is bonded to a special carrier protein called cortisol binding globulin. Cortisol binding globulin. So 95% is going like this, and only 5% is unbound or free cortisol is biologically active, and its level are carefully controlled. It's not uncontrolled, it's controlled. It's 5% and it is controlled. In excess free cortisol get filtered in kidney and dumped into urine. So only 5% is active. Other, if excessive amount is coming like a free cortisol, it will go to the kidney and it will dump via urine. So free cortisol is a part of circadian rhythm, like morning, evening. You will get energy in the morning and you will weak in the evening, like that. The cortisol level peaks which time and weak in which time. So cortisol level always peak in morning, when body knows we need to get up and go, we have work and we have to run, we have to do these things, and the level drop in the night, ready for the bed. In stress, The cortisol will increase gluconeogenesis. What is gluconeogenesis? Which synthesis? What is gluconeogenesis? Which synthesis of new glucose molecule, proteolysis, which break down protein. So gluconeogenesis means increased glucose molecule, and proteolysis means which break down protein. Lipolysis means breakdown of fat. So three terms you have to learn. So what is cortisol maintains BP? So cortisol is maintaining BP also. That means increased sensitivity of peripheral blood vessels of catecholamines, epinephrine and non-epinephrine. This narrows the blood vessel lumen. This corticols dampens inflammatory plus immune response by decreased production and release of inflammatory mediators like prostaglandin and interleukins, and also this will inhibit the T lymphocytes proliferation. This will inhibit the release of T lymphocyte proliferation. So this will lead the inflammatory mediators and everything will leads to the problem. So examples, I already told that inflammatory mediators are prostaglandin and interleukins, and this will inhibit T lymphocyte proliferation. Okay, and then we can move to some levels of free cortisol. It's not very important, but levels of free cortisol have to stay in normal range. If the free cortisol is increased, body uses negative feedback. This is straightforward, that have to stay in normal range, and if free cortisol increased, the body was using negative feedback. The hypothalamus and pituitary decrease their secretion of CRH and ACTH respectively. This is how the negative feedback is going. So less CRH also tell the pituitary to make less ACTH. So the pituitary end up having few reasons not to make ACTH. So increase less ACTH floating around the zona fasciculata gets less stimulation to make cortisol, and eventually the cortisol level go back to the normal. Straightforward thing. Fine. So zona fasciculata gets less stimulation of ACTH because ACTH is less there. So stimulation also less. Hope you all understand this much. So slowly we can move to our topic, Cushing syndrome. We all explained all the basic things. So what is Cushing syndrome? The cortisol level is increased or in excess amount of cortisol in our body. The cortisol level are higher than normal is Cushing syndrome. So there are some issues will happen in our body while the patient with the Cushing syndrome. So first one is severe muscle, bone, skin breakdown. So already we discussed about this, like proteolysis and lipolysis. Same severe muscle, bone, skin breakdown, elevated blood glucose level. So because of this glucose level is elevated in the blood will leads to high insulin level. This high insulin level will target the adipocytes in the center of the body. So in the stomach area, in the abdominal area, this insulin will target, and this will activate lipoprotein lipase. What is lipoprotein lipase? Lipoprotein lipase means which help adipocytes to accumulate more fat molecules. So here the abdominal area, the insulin will come and deposit and it activate lipoprotein lipase. What is lipoprotein lipase? Which helps adipocytes to accumulate more fat molecules. So it will lead. What's the result of this? What is the result? Yes, it's a center portion. So central obesity. Central obesity is the result of this fat molecule accumulation. What is the result? Central obesity. It's very important. So the third issue is hypertension. Hypertension is due to two reasons. One is amplify the effect of catecholamines on blood vessels. The second reason is cortisol start cross reaction with mineralocorticoid receptors, which normally only bind a related steroid hormone, mineralocorticoids, which are secrete from zona glomerulosa. These are the two main reasons of this hypertension. In other words, we can tell that because of the cortisol is structurally similar to mineralocorticoid, it can bind to that receptor and can trigger the mineralocorticoid effect, mainly increase blood pressure by retaining fluid. Any reasons you can apply here for the reason of this hypertension. Fourth one is it will inhibit gonadotropin releasing hormone, which produced from the hypothalamus. This is actually to help ovarian testicular function normally. Here it's messed up because there is no gonadotropin releasing hormone is producing. The fifth one is the patient immunity level will it will decrease, and the inflammatory response will inhibit, leads to the chances of infection. So immunity level decrease, the inflammatory response also messed up here, it all will leads to chances of infection. And also there is a point of brain function. The patient brain function is impaired, but it's not a main point here, but you can mention this also in symptoms like impaired brain function. So we can move to causes. Causes are exogenous and endogenous. Exogenous is from outside, endogenous is from inside. So exogenous is like medication, steroids like asthma, rheumatic arthritis. Some medications will lead to excess amount of cortisol. Endogenous is actually rarely it will affect. Endogenous negative feedback cause decreased CRH and ACTH and decrease cortisol production zona fasciculata, and this will lead to lack of stimulation of zona fasciculata, leads shrink and atrophy of zona fasciculata. This is a rare thing that the negative feedback is there. It causes decrease CRH and ACT, and this will lead to decreased cortisol production in zona fasciculata. So there is no production of cortisol, then the stimulation or the activity of zona fasciculata also will decrease, and that will leads to shrink or atrophy of zona fasciculata, because there is nothing to do, it's just simply sitting and it will go to shrink. And due to this shrinkage, we can see the adrenal gland also, the size will decrease. So adrenal gland size decrease. And there are some other endogenous causes also like tumors. So tumors also will cause increased level of cortisol in our body. So some tumors such as adrenal adenoma and adrenal carcinoma. Adrenal adenoma is benign and adrenal carcinoma is malignant. The cells in the zona fasciculata divide abnormally and secrete excess cortisol here, and leads to decreased CRH and ACTH production. Here the negative feedback, there is no issue, but the neoplastic cells are autonomous, meaning that they grow independently from any stimulatory signal. So the zona fasciculata is uninvolved. Normal adrenal gland will shrink and produce less amount of cortisol. The net result through is these issues is still abnormally high level of cortisol, and that cause Cushing syndrome to develop. This is the issue which come under the tumor issues, which leads the cortisol level increased in our body. Let's move to symptoms. So I will show you one picture here, and you can easily remember what all the things will happen in our body. So this is the picture. I can drag down. 1 minute. Yes. See, this is a patient with Cushing syndrome. See, the muscle wasting and thin extremities, you can see. The patient muscle is not healthy or it's not strong. The muscle wasting we can see in the patient with Cushing syndrome. And you can also see some bruising in the skin. So skin thinning and easy bruising is one of the symptom. See, easy bruising, and the striae, abdominal striae or lines you can see. abdominal striae or lines you can see, and increased fracture. The fracture tendency is increased due to osteoporosis or brittle bone. I'm sorry, I got a call. It's okay. So increased fracture chances due to fat distribution. There are many fat distribution. We already talked about this. This is truncal obesity or central obesity. The abdominal area, due to the high insulin level and the fat distribution, the abdominal area to increase the fat, and also buffalo hump. See the hump like structure in the upper body, backside of upper body, and see the face is round full moon shape. You can see moon like shape, full moon shape. Full moon shape is seen in Cushing syndrome. And we already discussed about hyperglycemia, diabetes mellitus, hypertension, and cardiovascular disease also. This patient will suffer with cardiovascular disease and poor wound healing. Why the infection chances are increased here? Because of immunity less, the inflammatory response are not active. So the healing stages of wound also here less. So poor wound healing, and the because of immunity less. So hyperglycemia, diabetes, everything we already discussed. I just again writing here for your retake. And also the females will suffer from amenorrhea, and some mental issues also will present. Amenorrhea and some mental issues. Let's move to diagnosis. Diagnosis is 24-hour urine sample. So we can see the cortisol level from the urine. So I told you that excess amount of free cortisols will filter in the kidney and will go to urine. The excess amount will drain to urine. So blood and saliva test also we can do, but the main is dexamethasone suppression test. Give a low dose of dexamethasone. It's an exogenous steroid. I already took that steroid. Suppress ACTH production and decrease cortisol. But here in Cushing syndrome, the cortisol level will remain same. So we can investigate like this. And treatment is depend on the underlying cause. We can treat the cause only pituitary adenoma. Except from the tumor, we only treat the underlying cause symptomatically. We will treat the patient. There is nothing more. And pituitary adenoma, we can do surgical excision. So hope you all understand Cushing syndrome, and we covered almost 80% about Cushing syndrome, and we will meet soon with another topic. Thank you.